Hello, everyone. Let me just give you a chance to log in and get your sound on. We will be starting in just a few moments. All right, seeing lots of people coming in. Hello, everyone. Okay, just giving you a few more seconds before we get started. We'll be getting started in just a few moments. Okay, thanks, everyone. Hello, and welcome to today's industry showcase, Moving Government Health Programs and Systems to the Cloud. Today is March 26, 2024. My name is Amanda Delory. I'm the Member Programs Coordinator at Digital Health Canada, and I'll be hosting you today. I would like to begin by acknowledging the Indigenous peoples of all the lands that we are on today. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the lands which we each call home. So please go ahead and share in the chat the territory that you are joining from today. And just on a technical note, please use the chat or Q&A if you're having any technical difficulties, and I'll be happy to help you out. And we will also have time for Q&A today throughout the presentation. So please submit your questions at any time, and we will get to them as we go. All right, so today's industry showcase is brought to you by Maximus. So thank you very much to Maximus for sponsoring today's session and for bringing together these thoughtful discussions. So it's my pleasure to introduce our presenters. First, we have Peter Smith, the Senior Director of Digital Health at Maximus. Peter brings over 25 years of experience in digital health technology, supporting various health-related projects for various provincial programs across Canada. Currently, he leads the eHealth division at Maximus in Canada within the Technology Consulting Services division. We also have Todd Merritt. He is the Senior Director of Digital Solutions, Technology Consulting Services at Maximus. Todd has had a long career in IT-related roles where he has worked as a consultant, lending his expertise in digital solutions and program delivery for projects in the private sector. His work has been focused on digital and business transformation. Currently, he is leading the digital practice at Maximus, where he is responsible for digital strategy and modernization. Todd's main objective is to help clients to reimagine citizen experiences and modernize front and back office operations using the latest digital technologies. All right, so thanks to everyone for coming today, and I'll now pass the mic over to you to get started. Thank you.
Thanks a lot, Amanda. Appreciate the opportunity to be here today and to get to talk to this group. I don't think there's much more introduction I can do after the lovely words that Amanda just said. So, Todd, I guess I'm gonna pass the reins to you to start.
Sure thing. Yeah, that was a very thorough introduction. Thank you very much. My name's Todd. I am based here in the GTA, and today we're going to spend some time talking with this community of practice about some specific opportunities and challenges and some of our observations working in the digital health space as it relates to moving applications to the cloud, but also modernizing and planning for these sorts of transformation activities within your organization. So the key topics we're going to talk about today are we'll define some of the cloud models that exist out in the marketplace and how they're being used, some of the advantages and disadvantages of those. We'd like to address what are the expected benefits that our clients are looking for when they decide to embark on their cloud journey. We do want to talk about some of the specific challenges that we observe specific to government and healthcare cloud migration journeys, but also some of the strategies that we have encountered in order to minimize some of those risks and challenges. And we're going to wrap up by talking about some of the other levers that we can use and some of the other key points that need to be considered as you yourself are planning your journey. If you have already embarked on moving some or all of your applications and technology to the cloud, we very much encourage you to participate and share. This community of practice will benefit from your observations, and if we don't want this to be a showcase presentation. It would be very great if everyone who has an opportunity to contribute does so. We won't take interruptions. They'll be fine. So moving along, just for those of you that are not familiar with Maximus in Canada, Maximus is a global technology infrastructure consulting company. We have projects and clients that span across the globe. In Canada, we are very much focused on public sector clients only, and specifically have experience running healthcare claims and payment systems for several of the different provinces. Specifically BC, Quebec, Ontario, and PEI. We're very focused on healthcare benefit program administration as one of our specialties. And I would say we're very focused on the Oracle application suite, both the traditional ERP as well as their cloud options as well. In the United States, we're a very large organization supporting many different federal and state and local departments and agencies across the board. Again, Maximus is largely focused on the public sector and government sector programs in North America. We also have a significant presence in the UK and in Australia. Before we move into talking specifically about cloud challenges, technology capabilities are spread across several different areas of Maximus. Just to highlight that we do have an established data and analytics practice. We are currently doing several engagements for public sector across Canada within our team. So just to alleviate any confusion, Peter runs our digital health team, which is focused exclusively on digital or healthcare industry clients, and I am focused largely on non-healthcare specific deployments of digital applications in the cloud. We have a digital strategy and modernization team. I run that, and also a team that's focused on our core product, Metagent, which is based on the Oracle e-business suite. So just a little bit about Maximus before we move into our core content. So let's start by talking a little bit about the impact of the cloud over the last few years. I myself had my first project implementation using the cloud in 2017. It was a major financial institution here in Toronto, moving some of their applications to Amazon. It was a really big eye-opener for me in terms of not just the raw capability of having cloud-hosted infrastructure in terms of performance and technology, but also really showed me the roadmap where we are now, 7-8 years later, where industries, organizations, and companies, both large and small, most of them, as we can see here, have already started to plan or in most cases move their technology into the cloud. Just to highlight that in 2023, more than half of small businesses are spending at least $1 million Canadian on the public cloud, which is up pretty significantly over 2 years. And for large organizations, we're seeing upwards of 80% of their spending on cloud being much more than that. Typically in the high millions of dollars. So for both large and small organizations, the cloud is becoming more important to their roadmaps, and also, quite frankly, is consuming more of their IT budget. In terms of the overall workload and data and how the cloud is being used, we're seeing that for large organizations, by the end of this year, we're expecting, based on the research presented by Flexera, is that over half of their IT workload is being moved to the cloud, with plans to move larger chunks of that over time. And it's a similar story for small businesses as well. Cloud spending can be broken down into subscriptions to things like Microsoft 365. It can be broken down into pure infrastructure spending by, for example, purchasing and using cloud instances of AWS. But cloud is not going anywhere. the amount of budget and workload that that is going to the cloud is only growing, and we expect this trend to continue. First off, I wanted to talk and look at some of the cloud deployment options that are out there. There are many complex decisions that need to be made about what is the best use case for cloud. Can it be done in a in a incremental approach? Some organizations look to do this in a big bang approach and plan to move an entire stack all at once. Obviously, the traditional non-cloud model has organizations hosting their applications and infrastructure on-premise. And that's the way that, up until maybe a decade ago, most of our clients were delivering in this model, hosting their ERPs, their core systems, and also their data either on-premise or in a co-located location. So like a remote data center, which may or not be yours. That's what we would call co-located. And as we step through these cloud models from the journey from 100% on-prem to something like pure software as a service, we can see that there are choices to be made in terms of what gets moved to the cloud and also the trade-offs in control, right? When we're talking about on-premise applications, the IT team, the IT department is responsible for all of the core pieces of the application. However, even when we move to something like co-location, some of the control and some of the ownership of the functionality does get dispersed or pushed to partners or vendors, which is something that we need to consider when we're planning out our journey. And there are advantages of the on-premise solution, and there are definitely use cases where it's just not going to happen that organizations are going to be moving into a hosted model because they need to retain control over all of the pieces of the application stack. Whereas with infrastructure as a service and platforms as a service, this picture becomes a little more blurry because there's still things that the organizations can own, like the structure of the application, the database and the data, and the middleware. However, things like the hardware, the facilities, the operating systems, the storage, some of these pieces may be controlled by the vendor 100% without client organizations needing to act. And then we get to a model such as software as a service, and I use Salesforce as an example here, also Dynamics 365, some of the other platforms out there where more or less, except for some light customizations to the front end, the entire technology stack is controlled by the vendor and are typically not something that are changed by clients. And so when we look out in the menu of options in the cloud, there is a lot of complexity on deciding what applications should we move, what pieces of the stack do we need to maintain control over, and what are we willing to turn over to the Microsofts, the Amazons, the Googles, the Oracles of the world in order to make those decisions. So deciding on the what, where, when, and why requires organizations to really step back and plan and take a look at their processes, what skills they have in place, the risks and the regulatory constraints that that may be applied to your organization. That being said, there are many benefits to moving to the cloud. One of the first cases that we see or that organizations look for is transitioning from an outdated infrastructure environment. So basically deciding to move away from a current implementation of technology to a new set of applications on a modern infrastructure. We've seen that in the healthcare industry, focusing on high value activities. So especially when it comes to customer facing digital applications, there is a use case here for moving to the cloud because it removes a lot of the overhead out of our IT teams and onto scalable, extendable, and secure infrastructure. Optimizing the environment. When we talk about pay-as-you-go options, There are definitely opportunities and benefits to not having to worry about upgrade paths for hardware and software and applications, especially in a multi-vendor environment. Streamlining the overall management of the applications is something that the cloud can assist with, especially if it has been re-platformed to a modern infrastructure. So even things like maintaining user profiles, Active Directory, security, most of the cloud applications and infrastructure tools present with a unified management configuration options in order to support that. Facilitating remote work by removing applications from behind the four walls of the organization and out into a hosted environment can speed up and increase the efficiency of the UI applications itself. Minimizing the capital expenditure. I myself have some mixed thoughts on this because I've worked with clients who love the functionality, love the modularity of cloud hosted infrastructure and applications. However, these do come with the costs, and these need to be planned for, and in some cases offset in other areas of the organization. And finally, just leveraging elasticity and the ability to scale. So, Netflix is an example I like to talk about because, if there are 1 million people watching a specific show and another 1 million people come on in a different time zone and start ramping up, the infrastructure itself is elastic and does not require any intervention from teams in order to procure or secure more resources to deliver those services.
Yeah, Todd, I mean, I think this is a good list. Some of the other things that kind of jump out when we think about the benefits of the cloud is the agility that goes along with cloud platforms and the perception of being able to respond to change quicker, and the the pace of innovation at the cloud level also provides some at least qualitative benefit for health organizations as well. And I think another one that you've kind of covered off here, whether it be facilitating remote work or streamlining the environments, is that ability to, or perception of being able to get the right data to the right people at the right time to make timely health decisions as well. So there is definitely certain aspects of the cloud delivery which allows certain benefits in those more kind of qualitative / clinical type settings as well.
Yeah, for sure. And this isn't an exhaustive list. There are things like data redundancy that are, fantastic benefits that we see as well. Backup recovery, things that don't always get top priority as programs are being rolled out. But just turning to the overall community in this webinar, is there anyone that would like to share maybe a benefit that we might have missed, or something that your organization has experienced that you weren't planning for when you embarked on this journey? And if you're not comfortable asking the question, if you're welcome to put it in the chat or the QA session of the Zoom call. Okay, well, we'll keep moving on.
Perfect.
Too many screens. Let me get over here. So given that we've just, defined that the cloud features and functionality and dollars being allocated to cloud infrastructure are growing, that there are a lot of benefits that are both real and perceived that need to be considered when people are planning or going through this journey, there are certainly challenges that are specific to government and healthcare that we'd like to have a discussion about today for the next few minutes. So first off, I would say the obvious one for me is just overall data security and compliance with localized regulations, right? Healthcare providers and processors of protected healthcare information, or PHI. historically, they've been concerned about storing or processing sensitive data in the cloud. And healthcare has always faced strict compliance requirements to protect their patients' records, biometrics, contact information, in some cases, financial information. And privacy and compliance concerns are always the top reasons that we hear from our clients for not necessarily moving apps to a different infrastructure. So, that's front and center. And we're going to actually circle back towards the end of the deck and talk a little bit more about some data specific considerations that we want to talk about. Number two, and I guess these aren't really in any particular order, but these first two tend to be the biggest ones that we see. Number two, reliance on legacy systems. So most healthcare organizations, certainly that I've seen in Canada, have been operating on-premise legacy systems for a long time. And the prospect of migrating these systems to the cloud seems very daunting and very risky. The third is cost uncertainty. As I said, and you're probably aware, depending on the volume of data, depending on the type of cloud delivery model that you're choosing to go with, there can be cost uncertainty up front. And we all know that healthcare faces a resource problem. There are not enough dollars to cover all of the different initiatives that are required by the government, and also the evolving demands of our user base, the patients and the citizens. Putting resources towards new medical equipment, staff treatments, all of this typically gets premier billing before debates over investments in cloud transformation activities. What we have noticed, though, is that the longer healthcare providers push this off, the more ground there is to catch up, which can make the initial transformation even higher down the line. Skill shortages. So there can be skill gaps that are a barrier to migrating to cloud solutions. Sometimes they are related to things like data exchanging and interfacing and going back to the PHI argument. Sometimes this may involve moving to new applications that have a steep learning curve for your admins, users, and everybody else. So just because we decide, hey, we're going to move everything to Azure, obviously we need to keep in mind that the organization may not have the skills in order to support that kind of migration. Day-to-day operations. So, surprisingly, from a business process point of view, moving applications to the cloud can have immediate impacts to how teams, application support teams, maintenance teams are run. Setting up and maintaining the policies, patching, vulnerability management, performance engineering, misconfigurations of applications are all challenges that we see in protecting the cloud workloads. And of course, bureaucracy and resistance to change. I think we see this across all of our jurisdictions, where just, the healthcare industry does face challenges in navigating internal politics, bureaucratic hurdles, and these are completely outside of what I'll call budgeting and financial considerations. So even if there is a clear business case and everybody's on board with what their solution should look like, there is an entire level of board stakeholder management with folks, stakeholders involved who may have different opinions on risk and adopting cloud technologies. So these are really the key challenges that we see. Again, if I don't have my chat window open, Peter, if you do happen to see anything, please stop me.
I have the chat window open here. I am just curious if with the audience that we have today, if people could throw some items in there that are challenges that they've either faced or dealt with as well, because I'd be definitely interested in bringing some of those forward to enrich the discussion a little bit more, right? So, we kind of try to focus on some main categories here of challenges, but definitely there's multiple layers under each one of these that can be fleshed out and definitely discussed, I guess, or shared in at a more detailed level as well. So is the chat actually working today? I haven't noticed. I've only noticed one comment in there so far.
Okay. Well, let's move on. And Peter, maybe we can give my voice a rest for a minute here. But, given that we've discussed these core challenges, and I think we've observed these in most of our client deployments. Sorry, my multi-monitor setup is, there we go. Okay.
All right, this is great. Now we're starting to get some messages flowing, Todd. So that's great. Yeah, so there's a lot of new to the cloud concepts, so lots to learn. There's always new stuff to learn for sure. Yes, and one of the challenges noted was to recruit the skills, computing skills into the public sector. So that's definitely a challenge. I would almost say not necessarily just for public sector, but even in the private sector, there's quite a fair bit of competition for cloud resources as well. Knowledge gap. Seems to be some common themes coming out in the chat, Todd, around
Sure.
knowledge and resources. Oh, here's a good one. What are some of the gotchas about costs associated with hosting in the cloud versus on-prem? That's a good question.
The gotchas. Ooh, that is a great question. Well, I mean, we can, towards the end when we get into the Q&A, I'd love to hear a little bit more specific detail about what cost challenges some of you have faced. I do know just off the top of my head that, based on outside of just the pure application infrastructure functionality, the way that a lot of these cloud providers are setting up their financial models has a lot to do with network usage and a lot of the personal health information, a lot of the medical records that are coming consume a lot of data. So although some of the upfront costs of actually putting the application on, say, Azure or AWS may be manageable, obviously there's the monthly recurring based on the data volumes, which in the healthcare industry typically are fairly large versus financial transactions going back and forth. So definitely some gotcha there is about the necessity of doing proper financial modeling, and the vendors themselves do have tools that will allow you to model based on your own internal usage patterns or resource consumption to get a better handle on what the costs are going to be. But we are moving into the hands where the vendors do have a little bit more control for sure.
Yeah, I think it's an interesting scenario, and has been around maybe too long in the technology space. There's a bit of a parallel to the old world where with the mainframes and running processes and jobs at night to save MIPS and all of those contexts, right? I think one of the important things is to understand what your workloads are going to be when you move to the cloud. The elasticity is both a blessing because it allows you to scale up quickly and easily, but on the flip side, it's also one that's easy to oversize and then not scale back as well. So, as we talk about some of the strategies to address the challenges, and maybe since that cost is kind of a main topic, we can kind of jump right in there. I think the key there is around having good monitoring and reporting on what your expenditures are. I know as Todd mentioned, there's lots of tools within that the cloud vendors provide that can allow you to monitor your costs and resource usage in pretty much real time. But also on the way into this process, to really model what your business flows are, what your workloads are is really important, and to have a budget and patterns that you know you're going to follow. Personally, having gone through this on a couple of implementations, and to be fair, we planned, and then it was so easy, we would have to kind of check ourselves pretty much monthly to make sure that we weren't spinning up too much infrastructure and utilizing more resources than we needed on an ongoing basis. So a bit of it's education and learning and understanding what that elasticity really means from not just a usage model, but also from a financial model. Do you think that's fair, Todd?
Yes. Yeah.
Perfect. Okay.
Talking a little bit about the data, and we're going to talk about this a little bit more because, unlike a few years ago, some of the commercial vendors in this space are much more prepared with healthcare specific solutions, right? So for example, data, PHI specific data considerations are something that most of the top tier vendors do have tools and procedures that are aligned with the law at this point. A few years ago, I think some people were on their own in terms of building a solution, end-to-end encryption, standardized formats for data exchanges and things like that. However, the toolkit and the assistance that you can get for your vendors is now out there and is something that are actually actively used to plan these things. Thinking a little bit more about what we talked about in terms of legacy systems, which gets special consideration here because we are fully aware that certainly in Canada, most of the healthcare providers and government still do have legacy systems. And some of the tactics that we see to reduce risk and to address these challenges can involve things like componentizing an application and moving specific elements of it to the cloud on a bit by bit, drip drip model, although we are going to talk about sort of the big bang approach as well. There are also vendors that do have legacy system specific solutions and migration tools that will allow that to happen. Now, are they going to be easy? No. Most of my interactions with legacy systems, that's not something, but there are tools in order to help that when we're looking at moving functionality. And in some cases, I will say we have seen organizations that plan to do a full modernization and in fact run parallel applications for a period of time until they're ready to move there and decommission their legacy applications completely, which does happen. Obviously, it's a larger, more complex journey to get there.
I think the legacy system topic, that one is a really interesting one for some of the reasons that you just mentioned, but also if we think about it from today's health system and the interoperability requirements as well, and is that helped by the cloud usage of the cloud, or in most cases it probably requires an additional integration type work to be done as part of these migrations as well, to make sure that the right information is shared between the right systems with the right security, of course, applied to it. Migrating data into legacy systems. It's an interesting one too, depending on the approach that's taken. In the old days, it would be a straight data conversion on a modernization, and with the different cloud models, we've still got to make sure that our data migration strategies are well thought out, well planned, well timed, and to make sure that the right information makes it to the cloud. With a bit of an added caveat on top of that is also what. I'll speak for myself on this one. What I've seen is a lot of legacy systems have kind of been grandfathered in or grandfathered by some of the updated policies and compliance requirements. So as we move and try to migrate these things to the cloud in one form or another, usually there's an additional complexity there, which is to make sure that all of the compliance requirements are well understood, planned for, and that the data retention, as an example, what data should we have, on a go forward basis versus what we had in the legacy world, and make sure that there's no direct impact to the associated business processes. So there definitely is some foundational planning there that definitely is required, and an understanding of our legacy system and our legacy environments versus the new modernized cloud environments as well.
Okay. Just in the interest of time, because we are going to circle back when we do our recap on some of these. I guess from one thing I will highlight, just in terms of addressing some of the day-to-day operational challenges. One thing that I've experienced cloud migrations is that one of the main features of using these tools is that there are built-in maintenance, migration, and support tools built into a lot of these. So it may mean redefining some processes. However, when it comes to actually, system monitoring, things like that, there are tools that simplify the administration of some of these applications. It doesn't necessarily add a new level of complexity. It can actually remove some.
Yeah, Todd, just before we move forward, there is some good conversation going on in the chat. There were some questions around is there cost predictability or Wild West pricing? Some great answers there around the fact that you can reserve cloud computing power for better cost predictability. That was a good addition to that discussion. Let's see what else we got here. Oh, definitely another point around the legacy systems and the challenges with integration. Thanks, Rob, for contributing to the discussions today. And this one we're keenly aware of, and actually working through today with the integration with Oracle's or the Cerner Oracle HIS portal. So that's good. I like the other note here that was put in the chat too around vendor lock-in, and I think that's a very important point to keep in mind as part of the strategies to address the challenges, whether that be the cloud, the cost uncertainty, skill shortages, and a few of these different areas. The kind of doing that due diligence up front to understand which cloud providers are the right for the applications you're trying to migrate, and whether a full-fledged migration to the cloud. Todd, as you kind of indicated at the first there with the various models, there could be some hybrid that might be applicable in some of those scenarios as well.
Yeah. Well, on that topic, it just so happens, let's shift a little bit and talk, a little bit more about some of the options. There are different ways to move to the cloud, the big bang versus the piecemeal. Is it part of a larger modernization? I know you have some experience in this area.
Yeah, and I think this was kind of I'll say a fairly thoughtful question that you and I kind of bantered about as we were preparing for today. Is what level of modernization do we need is required in order to go to the cloud? Do you have to fully modernize systems, or can you do some hybrid type approaches? And I think the modernization just by itself poses challenges in today's world, especially with a lot of enterprise health systems which have been around for, I'm going to say, decades, a long time. Those systems, just the thought of trying to modernize them definitely can bring a whole series of challenges alone, let alone putting in the cloud dynamic to it as well. So I think historically the models have been pretty similar to even what they are today, right? A full lift and shift type of approach, which can we take and pluck the legacy system out of the infrastructure and on-prem infrastructure and put it into the cloud and get it to work. The partial modernization can be can we take the key components of it and modernize it? Use digital services to replace pieces and modernize pieces of the application that need to be either directly public facing or even physician facing. And then the last one, which is probably the biggest bucket of work, would be around the full modernization. It would completely replace those legacy systems in order to take advantage of the full-fledged modern technologies and things like AI, machine learning, or process engineering, all of those kind of things that modern systems provide. So with all of those sitting there, what do we need to really think about? How do we make that choice? And I threw kind of 4 main points on here. Again, love people to put their thoughts in the chat as well. Actually, really enjoying the fact that people are providing some feedback and input into this topic. So, business objectives, always an interesting one. Are we trying to reduce cost? Are we trying to improve service delivery? Are we enhancing security? What are we really trying to achieve from the business level? Technical debt. Or can we still maintain the outdated legacy technologies? Are there complex dependencies there that we may or may not be able to break as part of a migration? What's the scalability on the legacy systems as well? So a lot of things around the NFR side as well. Cost and time constraints. Let's face it. Anytime there's time and money involved, it's always going to be a factor on the table. And depending on which approach is chosen, there's definitely an impact on both of those variables as well. And probably the one I think this theme on regulatory compliance is kind of spun through most of the presentation today, whether that be straight privacy, security, whether it be data sovereignty, access to personal information, and all of the legislation that governs that. There's, I guess the summary I would put on this is that there's no slam dunk. There's no easy answer to say, this is the way to go. But I do think there's, kind of a lot of different things that we would need to, go through, evaluate, and kind of have as part of a decision matrix in order to decide, what type of or what level of modernization would be required in order to move some of the legacy systems into the cloud. Todd, is anything else you can think of there?
I think you covered it, Peter.
Perfect.
Okay, let's talk for a minute about how to measure progress and some of the KPIs involved in planning and measuring actual deployments, right?
Yeah, I think we've talked a lot about the value that governments and health organizations would be targeting to achieve, and one of the important aspects of this type of project, but also really projects in general, especially when we've got public funds or involved, is how do we know that we're really going to achieve the value for the investment in time, money, and resource, and ultimately change management, right, to get to the new end state. So there's lots of different KPIs. I'm just going to pull out a few examples here. Service availability as a prime example, right? We talk about making sure we can get cloud solutions can get the right information to the right people at the right time to make timely decisions. Well, monitoring uptime and making sure that we have reporting and the SLAs are met in terms of that is a pretty critical metric. Cost savings, again, always going to be an important one to measure. We have our baseline cost for our legacy. What does it look like, year 1, year 2 of the new world? Are we are we saving money and really achieving that cost savings that we're attempting to anyway? Or if we're not, and the reporting shows that there's equivalent or more money being spent, it allows that real discussion to be had around why. Is that because there is additional work being used through these systems and whatnot? So the also I think the back again to the time to market, a bit of a qualitative more so than a quantitative metric, but is there more efficiency? Are we able to deploy new features and update applications more quickly, provide those improved user experiences in a timely fashion to the stakeholder groups? And last but not least, adhere to the security best practices and compliance and regulations, right? I mean, I think this one, some of us would say that's almost a no-brainer, but it's one we can't forget about, right? It's more than just setting it up. It's to make sure that, not just at day one, but also on day 5, day 20, day 300, right? That there is alignment, the auditing is in place, and the compliance to the policies, legislation, and whatnot is upheld.
Yeah, that's true. And a great segue to what I wanted to talk about next, just quickly, which is, in terms of key elements of data management that everybody needs to keep in mind, seeing as that this tends to be the biggest challenge planning and actually moving to the cloud, right? When we look, at least in the jurisdiction of Ontario, I believe this is fairly common across Canada. We are governed by the Personal Health Information Protection Act, which basically lays down the law in terms of how organizations can collect, use, transmit, structure data, share data. It applies to not only health information, but any health records or associated personal information for the patients. Within the PIPA, we've got the interoperability of health assets. So, we're mandated from the government that relates to the ability of different systems to access it and how is it controlled. The fact that we need to maintain traceability and logs for all of our PHI is something that needs to be considered when you're architecting any cloud solution. And this is not as important as it was maybe a couple of years ago, but standardized electronic data format and encryption to enable legal sharing of some of this information. So in the interest of time, let me just highlight a couple of the key considerations, right? So first of all, as we just talked, data security and compliance with regulations is something that needs to be top of mind when planning these things. Having the right skills and the right tools to manage the data itself, including medical records, electronic health records. We need to ensure that the solutions can manage this data within the constructs of the law. Same thing with data integration. How are things going to be moved to and within the cloud setup? Needs to be considered. What is PHI data, what isn't, how are the workloads structured to minimize the transmission and the risks associated with that. Protection, that should be fairly straightforward, but restricting access to and privileges on data is a key consideration when planning the move, and access control, which is important for all system deployments, quite frankly. Before we sort of wrap up and leave a few minutes at the end for discussion, we've talked today about why the cloud is important, a few different ways of approaching and how applications can be hosted and the infrastructure with that. We've talked about some of the challenges, some of the strategies to address those challenges. All that being said, it can be very daunting for executives and leaders who are responsible for building these solutions. We did want to point out that although there are guardrails and regulations governing this, there are also incentives to encourage cloud adoption for providers doctors, other organizations in the ecosystem. I did want to point out that the government of Ontario here has put together a digital strategy that was refreshed last year, which directs ministries, organizations, and others to adopt a cloud-first approach to modernization. And that's something that is outlined in a public document, right? This is really intended and does contain guidelines to assist you in your journey to the cloud, and to ensure that the processes, the data protections that you're looking at align with the government's thinking. So in addition to there being a mandate from the government to look closer at cloud solutions, the government is already building via the Ontario Centre of Innovation, cloud-based healthcare solutions. Under the directive of the Digital Healthcare Solutions Program, which is basically a funding mechanism to help organizations to do just this. So I won't drain, or I can't enumerate on all the specifics of how the funding program works, but there are incentives being provided by the provincial government here in order to make that happen, or to facilitate getting started and making sure that you're aligned to the regulations. And last but not least, I did want to point out that there are, and I think some people in the chat did mention this, that there are more mature commercial alternatives for cloud-based healthcare applications and interchanges. I just wanted to highlight a few that we have seen in action here in Canada. One is the Microsoft Cloud for Healthcare, largely built on the Microsoft 365 platform, but hosted on Azure. Has a lot of built-in data protections that align with the PIPA regulations. Same thing with Oracle. The Oracle Health Cloud is something that has been deployed in jurisdictions in Canada and does meet the requirements. Something that you can look further to. And also in places that you might not automatically think of in terms of healthcare, but even Salesforce itself has a health cloud largely based on its CRM product that helps in terms of case management, doctor management, and things like that. I don't believe it actually handles the exchange of medical records and things like that, but there are different solutions based on your requirements that are commercial and ready to go. All right, keep losing my mouse here. Oops. So just to wrap up for today, in terms of the best practices that we encourage everyone to consider as they're planning out or going through their cloud migration journey. Number one, align with the policy and legislation as it relates to data. I would say most people who are involved in this are aware of that, whatever jurisdiction that you're in. It's important to look at your current operating procedures, business processes, what needs to stay the same, what can be realigned within a modernization program and done differently. As Peter said, set clear and measurable objectives. Things like usage, system usage, other data and analytics that come out of these cloud platforms are pretty great, but they don't help if you're not using them to either do benchmarking or planning exercises. Consider doing things incrementally. It does not, well, I think that speaks for itself, but there are choices between doing everything at once in a big bang approach versus migrating elements of your technology stack to cloud in pieces. Continuous engagement with stakeholders, especially as we go up the chain to things like ministry executives, board members of other healthcare providers need to know what's going on and have that information backed up with metrics. Having a well-defined plan for data migration, I'd say that's the number one lesson I would take away from today's session, is that needs to be the main focus, just to make sure that we're all aligned to the regulations. And make sure that you're taking advantage of your deployment once it's up and running by using features like disaster recovery planning. Performance optimization is very important. So with that, I'm going to sort of leave the best practices that we've discussed today open, and I'd like to open the floor or the chat to any questions or comments that you may have about your experiences doing these migrations. Sorry, I need to move around my window here.
Let's see, Todd, I think there's one question in the chat. It's around AI. But can you comment on AI in the cloud and how AI can potentially accelerate migration to the cloud?
I can't speak to a specific use case for how using AI to actually do the migration. I can talk a little bit about some of the options available for doing data analysis is where I've seen most implementations of AI. So things like document and image scanning is something that's very has a good use case for AI in terms of pattern recognition that can be done. I mean, I'm not a doctor, so I don't want to put words, but I am aware of solutions that are able to look at anonymized data in the cloud and look for trends, maybe in the operational aspects of providing healthcare, but also within the specifics of diagnostics. And that's usually done by a third-party provider. So I don't want to get too much out of my comfort zone because I haven't seen some of those. But I would love to hear if anyone else has seen at least one other example of using some kind of AI plugin in an existing cloud to extract information. I'd really love to hear if anyone had an example of that. Okay. Yeah, I have just the question, I have heard of this vendor Nuance that does have I'm not sure if it's specific to a cloud provider or if it's just an application that you would add to your stack. So great, there's a lead. I'll have to go and check out Nuance to get a better understanding of that. Okay, well,
thanks everyone. I guess we'll appreciate your time today, but we'll hand it back to Amanda.
Yeah, thanks so much. Thanks so much, Todd. Thanks so much, Peter. I'm just going to quickly share my screen for a quick poll. We'll launch the poll in just a moment. Here we go. Okay, where is it? Okay, if I could just get a quick satisfaction poll from everyone, I'll give you about 30 seconds to get started. And yeah, thanks again, Todd and Peter. We'll also be emailing everyone who participated today so they can get in touch with you if they have any further questions. And as usual, we will be posting the recording of this session in our community. So if there was anything you wanted to revisit, then it'll be available. I'm just going to quickly end this poll and also invite you to capture this QR code on your screen to give us a little bit more fulsome feedback beyond just the quick satisfaction poll. I'll give everybody a chance to grab that QR code before they're leaving. And thank you very much, everybody, for having joined today. I'll just stop sharing now. And that's it for today. Thanks again, Todd and Peter.
Thank you.
You're
Thanks.
welcome.
Bye, everyone.